All right, today I'm going to talk about the advanced practice registered nurse role, competencies, and ethical foundations. The core and specialized competencies for advanced practice registered nurses include, so I'll talk about core first, is our direct clinical nursing care and practice. So that's taking care of a patient holistically, providing comprehensive assessments, and really using evidence-based treatment interventions for whatever diagnoses that we find in coordination with the patient. For psychiatric nurse practitioners specifically, we're doing a comprehensive psychiatric assessment. Another core competency is care coordination and case management. So that's helping to manage transitions maybe between healthcare systems or the communication between even different specialties. Um, Advanced practice nurse practitioners also focus on psychosocial health promotion and prevention. That is a huge part of the advanced practice role. We want to collaborate with patients, families, and community to really maximize health and improve overall health. We also can consult. We do a lot of education, again, for patient, family, and community. The advanced practice role is also a leadership position, and we can participate in health quality improvement initiatives. I feel like I'm going to be really passionate about like legislation, healthcare legislation once I'm done too, and I want to give back there. And then also research and practice development. We're really the leaders of that as well. Um, Psychiatric mental health nurse practitioners are educated and licensed to address provider shortages. If there's less psychiatrists, there are less people that are able to get mental health care. So the advanced practice role for a nurse, psychiatric nurse, is that we can give really great holistic care and treatment, diagnosis and treatment to these patients, helping kind of fill a need for providers. We can also work in diverse settings. Our specialized competencies really distinguish us from other advanced practice nurses because of our focused expertise in psychiatric assessment, psychopharm, psychotherapy, and management of complex mental health disorders. Next, I'll talk about the LACE model in advanced practice nursing. So LACE stands for licensure, accreditation, certification, and education. It provides a regulatory framework for ensuring that advanced practice nurses practice safely within their scope of competence and abilities. So licensure is the L. That's state licensure verifies completion of necessary education, clinical training, and all certifications needed, granting the authority to practice in our specialty. Accreditation is that that nurse must have attended an educational program that is accredited to provide such education, meaning their educational standards are up to a certain point. Certification, we must pass a national board exam so that we're proving that we minimally can we have at least a certain level of knowledge to treat the patient population that we are going forth to treat. And education, the patient population must have been covered in our accredited nursing NP program. So WSU definitely does that. The LACE model for advanced practice regulation serves as structure or architecture for states to standardize license, title, and full practice authorities for advanced practice nurses. When nurse practitioners practice to the full extent of their education and competence, demonstrated competence, the results can be high quality, more cost-effective healthcare and really improve patient outcomes. There is inconsistent adoption by the states. I think the MDs really support kind of keeping nurse practitioners limited in their scope, but we're lucky in Washington. We don't have that. Next, HIPAA and privacy in psychiatric settings. So HIPAA, super important, right? Privacy, protection of personal health information. We face challenges as nurse practitioners by balancing confidentiality with safety concerns. So if there's a duty to warn something of a potential dangerous situation that arises, managing information sharing in an integrated care setting if psychiatric care is embedded in primary care, navigating fear of HIPAA violations. So this can sometimes impair patient care because uh, if maybe we excessively restrict information for necessary clinical communication. As long as we're following the guidelines, it should be fine. And then psychotherapy notes are highly protected. And that's important. There are certain situations that they can be shared. So ethical decision making. We want to make sure our patients are consenting to things or requesting consent from them, even if it's not legally required. I mean, consent is huge and it should always be a main part of your treatment. Um, Ensuring patients understand the limits of confidentiality when treatments started, avoiding unnecessary breaches of privacy in the course of providing their care, keeping the information safe within the EHR, and then maintaining awareness that medical ethics and laws traditionally provide strong protection for patient communications, and you usually need release of information um, model. I do have one I'm going to go over a little bit, but I have an interesting ethical situation that I was just thinking about that I'm going to look more into. But what about a 16 or 17-year-old patient who has an opioid use disorder that would like to seek care for medication-assisted therapy? Like, are we required to tell the parents or not? Because you want to protect the privacy of the patient. I know in Washington State, the age is 13 for some consent issues, but this is kind of muddy for me, so I'm going to look into it.